Hi, guys. This is Mark Pellegrino. I guess we're a little unclear about who is going to start the show today, and welcome to this day's edition of the Daily Objective. And today we're going to be talking about Texas. Texas deciding to stop the mandates for the masks and let their citizens be free. I am not going to indulge in a long monologue the way Rucka might, because I want to get right down to business because we have the great Jonathan Hoenig here with us from Chicago. Not very Texan from my point of view. He's not wearing his Texas garb in honor of what the governor of Texas is doing for Texans today, but we'll excuse him for that because he's going to bring some great arguments to the table. I don't know if for or against yet, but we're going to see. Jonathan, what do you think about this mask mandate issue in Texas?
Thanks, Mark. And I actually do a lot of business in Texas, and as you pointed out to us before we started, a lot of objectivists have moved to Texas. There's actually a great history, particularly around Austin, of a lot of objectivists. I believe Dr. Tara Smith was there for a long time. Greg Salmieri, recently moved to Texas. So there's a lot of good things happening in Austin. Here's the AP article I'll share. And as you said, here's the headline. Texas on Tuesday became the biggest state to lift its mask rule, joining a rapidly growing movement by governors and other leaders across the US to loosen COVID-19 restrictions. The Lone Star State will also do away with limits on the number of diners who can be served indoors, said Republican Governor Greg Abbott, who made the announcement at a restaurant in Lubbock. Before even, without even looking at any of the so-called COVID data, how many people are getting it, how many people are dying from it, I'll have to say, I'm for this. I think, I don't believe that the restrictions, the lockdown should have been in place in the first place. I think this has always been kind of a method of altruism. I think the idea was as well, if old people, for example, have to be confined to their homes, then everyone has to be confined to their homes. If certain businesses have to be locked down or need to be locked down because people can't work for whatever, then everything. So I always think it was driven by altruism. And I applaud, I think it's way too late, but I applaud the government finally for stepping in and saying, all right, we're not gonna bring force into your life. Now, what you're finding though, interestingly, Mark, is that a lot of private businesses, as I've read, have basically said, look, we're gonna keep a mask mandate in place in our business for a period of time. I think that's fine as well. But government, in my mind, should never been involved with this. And I'm glad to see the Lone Star State moving in the direction of freedom in the right direction.
Now, the article said the largest state to lift the mandates. What other states around the country have lifted the mandates?
That's a really good question, Mark. And I would really.
While you may be looking up that information, I'll have to say that we have a rare point of agreement. It's often we have on the show objectivists on different sides of the issue. Today, we're on the same side of the issue. I agree that they should lift the mandates. They should do it universally. It's the egalitarians out there that say we all have to be in the same boat, and that's why these states have to keep these mandates. But the lifting of the mandate doesn't lift your own unique mandate in your own particular life to look after your own health. There's no reason why you have to go into a restaurant that's crowded beyond your level of comfortability. There's no reason why you can't wear a mask when you're indoors with other people and maintain social distancing. There's no reason why you can't solicit a business that agrees with the way you want to do things. None of that is being violated. So your own health is not really at risk. To the degree that you control your health, you still have that within your control, even more so because the government's out of your life and not forcing you to do things that you might think would be egregious in your context. Did you find any more states?
No, I was looking, I was listening to you, Mark, but I think, it's all about the principle, as I think you enunciated very well, and our own, what is the risk has always been the question the government asks. What is the risk to the public? But for us as individualists, as egoists, it's all about what is all about my risk, our individual risk, especially now the fact that a lot of people have gotten COVID and been tested and now have recovered successfully. A lot of people have now gotten, despite all government's haranguing and hangups, gotten the COVID vaccine. So people's own risk tolerance, if you will, their risk levels are changing all the time. So, this is, as usual, like for government, a too little, too late strategy. But it kind of goes to the point that as you allow people to use their brains to think innovatively, businesses to operate, individuals to make their own choices, they do so, and they make rational choices for their own individual context. That's exactly what should have been done in America, certainly in the UK from the get-go.
Yes, and if they don't make rational choices, then they pay the price for that. Unfortunately, the community at large is, I think, sort of saturated with that idea that your choices affect me, and because your choices affect me, we have to have some universal policy that prevents you from acting the way you would, because the way you act will hurt me. So we have to restrain each other with force.
Now, Shadowblade, who has contributed, I believe, in the past, not today yet. And thank you, LMH, for contributing £5. We really appreciate that. All of our Super Chat contributors, they keep the lights on, if you will, here at the Ayn Rand Center UK. So thank you for that generous donation. Shadowblade says that he believes it's Montana, North Dakota, and Iowa that have lifted the mask mandates, if you will. And Mark, I think you raise a really good point too, that this doesn't change necessarily how you want to live your life, how your individual situation. Like, I don't want to be around a lot of people who haven't isolated, who've been, I'm just simply not comfortable at that point. Now, I have some pre-existing conditions as well. We don't have to go into all that, but I know my own risk tolerance and my own interest and et cetera, et cetera. But, this is a small step in a good direction in terms of moving forward with life and people having to get a sense of their own risks and their own risk tolerance in terms of where we are in the pandemic right now.
I wonder when your health became somebody else's responsibility. When did this happen?
Yeah.
Can we pin a date, a start date to this kind of insanity?
It's a really good point. And also, this idea that because, and look, this is never any medical advice here on the Ayn Rand Center UK, but as I understand it, the virus COVID-19 in effect most affects those people who are older, let's say 60 and 70 older, is most debilitating. The fact that they might need to quarantine, they might need to wear masks or be more social isolated, now means that everyone, even children, have to be socialized, we all, as they say, are in this together. So it's exactly as you said, Mark, it's that it all goes back to basic ideas. Always. And in this sense, egalitarianism, altruism, if someone has to sacrifice, everyone has to sacrifice. That's driven the pandemic from the start. It's even driven the antidote response, the virus or the vaccine response, of course. I live in downtown Chicago, and right across the street from me, there's a prison, the Metropolitan Correctional Center. And who's in the prison? R. Kelly. Did you ever meet R. Kelly, Mark?
I've never met him, but I'm pretty familiar with what he's done.
Well, he's done a lot of terrible things. Now, R. Kelly has the COVID-19 shot, the virus. He was given, not the virus, he was given the antidote by the government in the pen, 2 blocks from me. I'm not even in the hopper yet to get the pen. Or to get not in the hopper for the pen, and certainly not in the hopper for the vaccine either. But there's that sense of altruism, egalitarianism. We're all in this together. That R. Kelly has the virus, and my family don't.
It's most moral to give it to the people who deserve it least. I guess that's the sort of way they approach it. I traveled across country to come to the state that I'm now working in. And look, my health was entirely in my own hands. I stayed in several hotels along the way, but like you, I have pre-existing conditions that make me a little bit more vulnerable to this than other people my age, and I took precautions accordingly. I'm COVID negative. I was just tested yesterday, but that doesn't mean that I won't get the virus. This is not a risk-free world. We live in a world where walking outside is a risk. And getting out of bed is a risk. Everything you do on some level is a risk. And it's up to you to manage that as best you can. You can't eliminate the risks entirely. And I feel like a lot of this has had the standard of eliminating the risk entirely. There was a point at which I heard Dr. Fauci talking about, well, after you get the vaccination, you still have to be careful with respect to social distancing and stuff, because if you have, there could be viral elements in your nose. There could be pieces of the virus on you that could be transferred to someone else. I'm completely bastardizing what he said, but he was coming from the premise that there has to be zero risk for us to restart the economy. In Texas, somebody has to be the first, for crying out loud. Somebody has to be the first to take the step out into the darkness and say, we're going to take the risk because our lives depend on it. Our lives depend on production. Our lives depend on economics. One of the most terrible things I think the political class has done is to pit our productive living lives against our survival, right? They put the two in conflict with each other, and they cut off our means of living in order to keep us alive. And they did it with impunity. People just sort of followed along with it. And it's frightening.
Yeah, and what's also been inspiring a little bit is to see the creativity along the way, Mark, of so many businesses, big and small, dealing with the pandemic, coping with the pandemic, all across the kind of food chain, if you will, down from the kind of the delivery drivers on the very low end to even someone I follow a lot of interesting, let's just say, people on Instagram who are making money in very unique ways now, given the moment. A lot of performers, if you will, who are making money in interesting ways. So, I mean, it's been inspiring to see a lot of the restaurants, for example. Here, there's the very famous restaurant Alenia, that is a kind of the world-renowned Beard Award-winning restaurant, etc. So they've cooked up a delivery menu they do now. So businesses big and small have kind of adapted to cope, to make money, to be able to continue to thrive. And when they're making money, Mark, it's good because everyone's making money. Values are being satisfied along the food chain. So let's hope that in the near future, we're going to come to see COVID as something that we're dealing with, but that we're dealing with successfully, and that we're moving on with the values in our life. And the fact that Texas has removed this mask mandate is a small, but I think very important step towards some of that freedom, and some of that freedom not only from government, but from COVID writ large.
Now, do you think the population at large is going to learn that lesson?
Well, I think it's too early to write that lesson of what do we learn from COVID. But I think what's certain is how quickly so many Americans were willing to let government come very closely into their lives, control their lives, shut down their businesses, how there was really no uproar from Democrats, but even from those on the so-called right, if you will, Republicans. So that willingness was almost universal. So that's probably the most frightening thing from COVID, in my estimation, from COVID. Not to mention the debt that we're all going to be left with. Mark, it's like, this wasn't necessarily on the topic today, but the pandemic, thankfully, thanks to the scientists, thanks to the business people, thanks to the frontline workers, thanks to the janitors, staff, COVID is finally kind of starting to get in our rearview mirror. But the spending is just getting started. That is the political spending, and that's going to be the long-term chain around our neck, if you will, for decades and decades to come.
Yeah, we're already at $26 trillion in debt, which is unbelievable. And they're trying to pass the $1.9 trillion. Is that a stimulus, COVID relief package? It seems like a combination of the two. That's just going to shackle future generations with more debt. And there's a monetary theory out there that allows them to do this with impunity now, right? Modern monetary theory just says, hey, print money and tax it out of the system and you won't get inflation. We'll be fine.
Yeah. Well, we're going to talk quite a bit about that in the days and weeks and months to come. Thank you, Shadow Blade. Thank you, Mary Aline, for your support. Thank you, LMH, and thank you all for your support for what we're doing here every day on the Daily Objective, having people, everyone from objectivist scholars to actors, people in business like myself, and from all over the world, and not to mention you in the chat who are kind of making us part of your day and part of your media diet as well. So we'll kind of get into all these issues, but we'll wrap it up a bit today and cut today's episode short, if you will, or keep it on time actually, because we usually aim for 15 to 20 minutes, by saying that there's a small kind of maybe feather in the cap of freedom today as Texas is moving to ease some of these COVID-related face mask requirements, and freedom is ringing a bit more loudly in the Lone Star State. Thank you for being with us. Thank you, Mark, for being with me, and we'll see you right here at the same time for the Daily Objective. Thanks again.
Thank you.